Good afternoon. On today's press briefing, we'll hear from Milwaukee County Executive David Crowley, Mayor Tom Barrett, Dr. Ben Weston, Director of Medical Services for the Office of Emergency Management, and Dr. Jeanette Kowalik, Commissioner for the City of Milwaukee Health Department. Thank you all for being here, and I'll hand it over to Milwaukee County Executive David Crowley.
Thank you, Catherine, and thank you everybody for joining us, and good afternoon. I want to start off today's briefing acknowledging the unfortunate tragedy that took place in Kenosha this past Sunday. I want to join the family and friends of Jacob Blake in praying for his recovery. This is another tragic example of the racial disparities and inequities that make Southeast Wisconsin one of the worst places in America to be a person of color. Our goal as a county is to change that. And Milwaukee County is using racial equity lens to develop the first strategic plan in 20 years. This time, we want to focus on the change. And we know that change, it always starts now. And I stand with those leaders within government and outside of it who are committed to undoing generations of racist policies and practices that have cut the lives of so many residents of color. And for individuals partaking in opportunities to express their voice this week, please remember the 3 W's, which is watch your distance, wash your hands, and wear a mask. It's important to be heard, but equally important to make sure you keep yourself safe and others safe as well. And as we think about inequities, one way Milwaukee County is building its strategic plan is with the racial equity lens, is through our budget process. This morning, we held our very first budget town hall meeting to engage the community in addressing the $42.5 million budget deficit that we're facing. And we appreciate all the questions submitted by folks and look forward to reviewing the suggestions made by people via the Balancing Act tool on the Milwaukee County website. And as a reminder, it only takes 15 minutes, so please visit our website at county.milwaukee.gov so we can get your input and can inform how we address the Milwaukee County budget crisis. I, along with the county supervisor, will also be hosting more budget open houses, and we would like to invite the public to attend. Our second meeting will be held virtually next Wednesday, September 2nd at noon, and then we'll have a third open house which will be offered both virtually and in person on Tuesday, September 8th at 6 p.m. So if you have questions or would like to participate in our public comment, you must submit your request at least 24 hours in advance of the meeting. And you can do that by also visiting our website at county.milwaukee.gov for more details. And as we continue to talk about back to school, and some kids have already started classes, please remember that your kids' wellness checks and flu vaccinations this fall are more critical than ever. Historically, flu vaccinations have been fairly low here in Milwaukee County. Last year, we only had about 38% of Milwaukee County residents who received a flu vaccination. And to change this narrative and to make sure widespread flu immunizations are accessible to low-income and other vulnerable populations, a work group has been created that engages our local health systems, clinics, and health departments to ensure that we increase the rate of vaccinations this fall. It's a great example of our community partners collaborating and sharing resources to address racial inequities in the health systems and develop results-driven solutions that will increase vaccination rates in our county. I want to thank everybody involved in this important work. We'll continue to share details about where you can get a flu shot this fall, because we need everyone to do their part to keep not only themselves safe, but our whole community safe. And with that said, I'd like to hand it over to Mayor Barrett and say thank you for your leadership as it relates to everything that we're dealing with this pandemic. Thank you.
Thank you very much, Mr. County Executive. And I want to echo the County Executive's very thoughtful comments on the racial issues that we're seeing, in particular what's going on in Kenosha right now. Unfortunately, it's another tragic reminder of how far we have to go as a state, as a nation, as a community in dealing with the racial injustices that we unfortunately see far too often here locally, throughout the state, and in the country. So there clearly has to be a lot of work done. I'm very, very hopeful the Department of Justice will come in very, very swiftly. It is imperative that we have that analysis, that it's a transparent investigation, that it's an honest investigation, and that it's a prompt investigation. I will say I'm pleased as I look at what we're trying to do here locally. We have had body cameras in the city of Milwaukee now for many, many years because we know how important they are. If it were not for that citizen close by who had a cell phone who was recording that incident in Kenosha, I don't know if we would have ever known exactly what had happened. And obviously there's more work that needs to be done. But that tells you how important it is that we have these recorded histories of what's going on. And I'm very, very pleased that the city of Milwaukee was certainly one of the leaders in the state and one of the leaders in the nation in making sure that we have our police officers equipped with body cameras. That's something that's very, very important. I want to talk about COVID because obviously that's why we're here today. Just a quick update on our National Guard testing numbers as of August 24th. Our UMO site had 915 individuals. Our Custer site had 439. That brings our Milwaukee total to 1,354. As Dr. Weston will tell you, the numbers of people getting tested are coming down, which is unfortunate. Some of that may be due to the testing that was done last week with the virtual DNC convention. It's my hope that people will continue to be tested. So we want to see more testing done. The good news is, again, as Dr. Weston will talk about, is that the positivity rate is coming down. And that's something that to me personally is extremely significant. And I think is really a good sign of what we can do and should be able to do as a community. So I want to talk about that because I think one of the reasons we're seeing a decrease in the positivity rate is because of our local mask ordinance and because of the mask order that has been issued by Governor Evers. And I want to put this in a little different context. I like to watch some films about World War II and the World War II period. And just recently, as I was watching one of these films, it struck me as to how patriotic people were in supporting the effort. And it made me think, in many ways, what we're facing right now requires more patriotism as well. And I honestly believe that it is patriotic to wear these masks when you're interacting with other individuals. Again, if you're out by yourself, if you're at home, if you're not interacting with other people, that's not the issue. The issue is you're in public with other people, close to other people, and you're not eating or you're not drinking. Be patriotic, because this is our enemy right now. The pandemic is our mutual enemy. And if we are going to defeat the pandemic, we have to come together as a nation. And so all politics aside, I think it's patriotic for us to wear these masks to make sure that we're doing everything we can to slow down and hopefully eradicate this disease. So that is my plea to people. Again, what we've learned is that we can do this most effectively by working together and by wearing masks. And the group at Mask Up MKE has been doing tremendous work to help fight this virus. So I want to thank Mask Up MKE for everything it's done. It's built an incredible coalition of Milwaukee leaders, of business and community organizations, and helped unite everyone around a common goal. So they're truly making a difference and they're saving lives, and that's what we're all about. We want to build a stronger partnership, and we can build a stronger partnership with Mask Up MKE. So again, let's do everything we can to make sure that we're eradicating this. The commissioner is going to talk about going back to school. That's clearly an issue, because not only is it an issue for the students and the parents, it's an issue for teachers, it's an issue for daycare providers, it's an issue for everyone, because there are so many critical components about getting kids back to school, particularly when you've got so many parents who are working, who don't have the luxury to be able to have this flexibility to decide what they're going to do with their day. So a lot of work that needs to be done, but there's been a tremendous amount of work that has already been done, and we want to continue that. So with that, I'm going to turn it over to Dr. Weston.
All right, good afternoon. Thank you, Mr. Mayor. First to our numbers, as always, we've had 23,353 confirmed cases of COVID-19 in our community and 403 individuals who've died. As discussed by the county executive and by the mayor, in a time of continued troubling news from COVID, from racial equity, racial justice, and other individual and systemic challenges, I think we can provide an item of good news today, and that's that promising change in our key indicators. So we saw our cases indicator turn from yellow for caution, where it's been for weeks, to green. We're seeing a statistically significant decrease in our percent positive number, a nice downward trend in percent positives. This is a key metric to watch. We watch it closely in the county. I know the city watches it extremely closely. Both of us have seen downtrends. And this is the metric to watch to really understand the disease burden that we're seeing in our communities. And this is a testament to the mask wearing and the physical distancing that each member of our community is engaging in. So keep up that good work. We can hopefully continue to drive down the amount of COVID in our community. And speaking of driving down COVID, many of us are starting to think about Labor Day plans. We'll certainly talk more about this in the coming week, but events like Labor Day, if not celebrated carefully, can certainly lead to a damaging change to the trend of disease in our community. As you make your plans, think about staying outdoors, keeping distance from others, and wearing masks. You can still have a very nice gathering with your lawn chairs spread 6 feet apart. Finally, a quick note about a media story that's been circulating on the individual in Hong Kong found to be reinfected with COVID-19. So it's an early story. We certainly need to learn more about the individual case, but it does appear to be a rarity to be reinfected. There's been 23 million cases of COVID globally, and this has been the first one to seemingly demonstrate reinfection. That is somebody getting the disease again after they've already had it. Of note, the individual apparently had less severe symptoms the second time around, so that indicates some protective immunity. However, the obvious question here is about durable immunity. So that is how much lasting immune protection is provided after someone is infected from COVID-19. So this will be a case that's certain to generate a lot of interest and review and research as we work toward development of an effective vaccine. So more to come on that front. I'll stop there. Thank you and stay safe. And I will pass it along to Commissioner Kowalik.
Good afternoon. Thanks, Dr. Weston. As noted, our numbers are getting better as far as looking at our positivity rate. So the city of Milwaukee is at about 5.7 right now. And, you know, we always reevaluate our information one time a week for the city, Thursday afternoons. And then we issue media advisories on Fridays. When we had our first case of COVID, which was on March 13th. So this past Friday marked week 23. So you can see we've been dealing with this for quite some time. I know everyone's tired of it, but we can live life in a new way, embracing mask wearing, as Mayor Barrett noted, and looking at it from a sense of our obligations, not only to ourselves, but to one another. So I have received a number of questions about masks. Again, shout out to Mask Up MKE and Rebel for all of the work that they did. We had a kickoff last week for the HOP, and how the HOP has a car that has a mask, and one of our ads from the PSA, which was awesome. But just wanted to give everyone a pro tip for masks in the summertime, and some of the questions about utility and being able to breathe. So I've found that wearing paper masks or the surgical masks are a little bit better in the heat. So having some options, having a cloth mask so that you can, you know, definitely be a good steward of the environment, washing those masks after each use, and having a variety of masks to kind of go through the week, and then having some of those paper surgical masks, which are more available now. I just ordered a pack off at Amazon last week, so much more available. The price gouging isn't where it used to be. So I just wanted to put that out to the public, because I know there's been some questions about wearing masks, especially as we were preparing for a heat wave this week, so that you can still wear a mask and have some protection. But again, the health department is committed to providing masks to the community. So we are purchasing thousands of masks and working with a variety of vendors, local vendors, as well as some national vendors, to bring thousands of masks into the market. We do have a beta version of our website, milwaukee.gov/masks, and it'll show all of the distribution points for the masks. Right now, it still has the health department clinics as options, but we will add more as those other sites receive their initial installments of masks to be given out for free to our community here in the city. And speaking of our lights, our keep down right now due to a power outage that started yesterday, but apparently hasn't improved today. So just to give everyone a sense of what normally happens at Kenan Health Center. Kenan is located off of 36th and Fond du Lac in the city of Milwaukee. It's located like right across from Sherman Phoenix and Milwaukee Police Department's District 7. Normally during the day we have WIC, We have our health insurance access program.
Catherine, is she frozen for you also?
Yes, she is. All right. Okay, well, while we wait.
And no, we're going to continue to monitor our numbers for school, right? We want to make sure that school, back to school is safe and that we're not seeing any setbacks. So it's really important to make sure that we're maintaining the gains and educating children about proper mask use, as well as making sure they have access to masks in the first place, increased hygiene and distancing. So really retraining, educating our youth and our teachers and education professionals of what needs to be done to prevent the spread of COVID-19. We're just, again, going to have to live in a new way. So limiting the hugs and the handshakes and all of that that normally goes with coming back to school and being around one another. Also being mindful of symptoms, whether it be a scratchy throat or kind of hot, maybe feverish, things like that, checking for those things, not dismissing any symptoms one may have. We know that there's people, including children, that may have COVID-19 and may not have symptoms. So it's important to just really be alert to get tested. There are a number of testing points through the healthcare partners in our area, as well as the community testing sites that we have, as Mayor Barrett noted, UMOS and our Barack Obama High School. And then there were some other testing sites that were added. Last week there was one at State Fair. So just looking for more opportunities to provide testing to the community, especially as back to school gets underway, so that there's limited or no barriers to being able to get a COVID-19 test. But as far as schools are concerned, we keep receiving questions from the media about how is the school plan review process going, and it's going. Not every school has submitted a plan. Of course, Milwaukee Public Schools is the bulk of the schools in our area, and we've been in coordination with them for quite some time. But for non-public schools or private or charter or parochial schools, we have received 42 plans to date. 19 have been approved and 8 are pending some additional adjustments. So we will release that information, meaning that is what schools have been approved, every Friday, just to provide the public with a sense of what's happening. We're getting a lot of inquiries. So just wait for Friday. We have our Friday standing update through the media advisory, so that information will be shared on Fridays. And also, just a reminder about our back to school health fair, which is coming up next Monday. And normally that would have happened already. We normally have the back to school health fair is a 2-day thing. We have 1 week is on the north side of town and the next week is on the south side of town. But due to COVID, we're having a virtual event. So Monday, the 31st from 10 to 2, we will give out over 3,000 backpacks full of supplies and COVID prevention items at 4 sites. So the 4 sites are Hopkins Lloyd, which is 1503 West Hopkins Street, River West School is 2765 North Fratney, Greenfield Bilingual School, which is 1711 South 35th Street, and Kilbourne School, which is 5354 North 68th Street. So again, just acknowledging our partnership with the Milwaukee Public Schools and Dr. Posley and all of his staff that have worked to help provide access points, not only for the back to school health fair, but food and other items ever since COVID hit our area, so continue to provide supports. And then lastly, I want to talk about businesses. So just reminding businesses that have not submitted COVID safety plans to please do so. We have received a number, so 70 plans have been received to date and 58 have been approved. So that's great. I know that there's many more that are in the process. Conversations are happening, but we have not seen a variety of plans from bars. So we want to remind bar owners that you have to submit a plan as well. So please get your plans in by the 15th of September. They don't have to be approved by them, but if you want to continue to dine indoors or outdoors, you have to have a plan submitted by the 15th of September. So again, our website, milwaukee.gov/MMFS, it has additional information, including copies of the webinars that we've been sharing with the public related to specific sectors. And then our milwaukee.gov/coronavirus website, which has our city dashboard, but other information as well as outreach materials in a variety of languages, so Spanish and Hmong. So those resources are updated on a very regular basis, so please continue to use them. And then again, we just want to remind our community to, again, embracing masks is part of our new way of living. Shouldn't be a political statement. It's meant to provide protection for yourself and for others. And then the hand washing, the hygiene, bringing alcohol sanitizer is more accessible now, so definitely shouldn't have issues like before. And then lastly, the distancing. So just because you're wearing a mask doesn't mean you don't distance. You should be doing both. So 6 feet apart from other people. And then outdoors is preferred versus indoors. So enjoy the warm weather while you can. Thank you.
Thank you, Commissioner. We'll now take questions from media on today's call. And Mayor Barrett, perhaps you can address the first one, which comes from Rachel Glassick with TMJ4. She asks, did anyone from the DNC or with the DNC test positive last week?
My recollection is there may have been someone who tested positive. I don't know if they were with the convention, but it was nothing that alarmed me or I think alarmed anyone else. There may have been someone, but again, there was nothing significant that was reported to me whatsoever.
Thank you, Mayor. Our next question is from Patrick Polentolio with WISN 12. He asks, with schools going virtual and some private organizations are offering tutoring, help with virtual learning, or care while parents are at work, kids will be congregating. And does that defeat the purpose of no in-person school? And for Commissioner Kowalik and Dr. Weston, have there been any outbreaks at private in-person schools in the city or surrounding communities in the county?
Yes, schools have just been ramping up, so we haven't received any updates of any outbreaks yet. But as our plan states that if there's 2 cases, then there needs to be a pause and detect what cohort the youth or teachers are associated with and try to snuff it out before it ends up becoming a bigger thing. If 3% of the population, again, we're capping at 50%, have COVID, then that's a shutdown until we can get a handle on the situation. So that's for the city of Milwaukee, not the county, not the other jurisdictions in the county, just city of Milwaukee. I want to be clear because I hear that sometimes there's this, the county health department, there's no county health departments. Again, this is related to the city of Milwaukee. And I appreciate the question because human behavior is we like to be around other people. We like to congregate. So there needs to be some education, constant education and reminders about congregation for our kids because the default is wanting to be around. And how do you do that in a safe way? So distancing, mask wearing, making sure that hand washing and sanitizing hands whenever you're moving around or anything like that, coming from indoors or whatever the case may be, that there's just a constant reminder of what needs to be done to prevent the spread of COVID-19. So we were mindful of that about people setting up cohorts and other ways to kind of serve as pseudo daycares for parents. And, that can be problematic, obviously, but again, trying to prevent the spread. So that's what we're hopeful on or about right now is that we can just continue to get the message out that we understand that it's been rough. It's been rough for all of us. We can still do things, but we have to change the way that we do them. So.
Thank you. And Patrick's second question is for Mayor Barrett. He mentions that you talk about wanting more people to be tested. If that doesn't happen, would the National Guard community testing locations be in jeopardy?
Before I get to that, I was able to get some updated numbers on the DNC, so I'll just share them with you. Here's the revised info from the DNC. This was as of Thursday at 5:30. There was, looks like a total of 7 that tested positive, 1 from Hales Corner, 1 from Germantown, 1 from South Milwaukee, and 4 from the city of Milwaukee. Let's see, all Milwaukee positive tests were notified to the Milwaukee Health Department. Others refer to those jurisdictions. So per the DNC, everyone was followed up by Milwaukee Health Department for their contacts in a timely fashion. So that was the information I had. So that answers that question. With regard to the National Guard, I remain optimistic that we will have them with us through the end of this year. That's what my hope is, and maybe even beyond that, because we know that there's not a calendar ending to this pandemic. We hope that it's done by then, but we don't know that for certain. I will say this, and I've said this before, and I'll say it again, how thankful I am to the governor and the state and the National Guard, the individuals from the National Guard who are helping us in this regard. And I concur with Commissioner Kowalik that public health needs more resources at the federal level, the state level, and the local level. And when we look at what's going on right now in terms of dollars that are coming in, it really is those CARES Act dollars that the federal government provided to the state, which they are using to pay for the National Guard, which bolsters our capacity as a local health department to do the testing. Again, it's really a partnership with the health department and the state of Wisconsin. The county obviously is involved as well. And so when I look at the resources, I look at all sources of resources. I look at the local property tax resources, I look at the state resources, and I look at the federal resources. This year, without a doubt, the CARES Act has provided literally tens and tens of millions of dollars to the state and to the local government to pay for the testing that's occurring. We're doing a lot of the work with the tracing. Again, we're using some of the federal dollars for that as well. So I think that's important to remember. We want to get a more constant funding source for public health, but I think it's important to acknowledge that there is work that's being done there as well. So again, my hope is that we continue to have that testing by the National Guard through at least the end of the year. But again, I think a lot of that will be dependent on how much they're being used. But I still think having 1,400 tests a day tells you that there's still a lot of demand out there. Not as much as Dr. Weston would like or Commissioner Kowalik would like, but it's still significant.
Thank you. Our next question is for Commissioner Kowalik, and it's from Anisa Johnson with the Milwaukee Journal-Sentinel. She asks, can you speak to the thinking behind not identifying cases by schools? There is a concern among employees, parents, open government advocates about the lack of transparency on this front.
Well, we've heard this same conversation for every other sector, so this is nothing new. We heard this about long-term care facilities. We heard this about businesses where essential workers were concerned about their safety or business practices, safe business practices being upheld or not. Now that school is going back in session, now you're hearing the conversation about schools. And it's not as easy as making the just executive play call that we're just going to release all names. There's a cost benefit that happens when it comes to these types of situations. There's conversations that need to happen with school administrators, that need to happen with teachers unions, that need to happen with the state DPI. So conversations are happening right now, but we definitely have not gotten to the point where we're going to commit to releasing names at this point. Again, it's August 25th. Some schools are just going back into session. Some are preparing to. Most schools are still virtual though in the city of Milwaukee. So it gives us a little bit of time to kind of figure this out. We do know too that even with childcare centers that the state regulates childcare centers. So like releasing names of childcare centers. A lot of times what happens is there's a lot of social media buzz where a parent or an employee will go on and say, hey, there's an outbreak here or something like that. Or I have COVID, and then you know where they work, and then that information gets put out. So it's a sensitive topic. It requires a lot of conversation, communication, and listening before a decision is made on how this is going to happen. So I appreciate the question.
And she does have a follow-up question for you. She's wondering, would it be possible to know which of the schools are opening in person on those Friday reports that you reference?
Yes, we can provide that update. So like I said, on Fridays, we would have that information. Thanks.
Thank you, Commissioner. Patrick Polentolio with WISN 12 has a question for County Executive Crowley. He says, can you elaborate on the effort to educate people about getting the flu vaccine? How does this outreach work in a pandemic? And perhaps Dr. Weston too, you might have more information.
Well, we have a cross-collaborative work group that is working together to put a flu vaccine campaign together. The best time to really get a vaccination is in September and October, so more information will be coming down the pipeline. But it's also utilizing platforms like this, utilizing social media. We need to make sure that when we tell people about the flu, those who have been disproportionately impacted, like people of color, we want to make sure that they have access and we distribute that in an equitable fashion.
Couldn't say it better.
Awesome. And Patrick's second question is for Mayor Barrett. It's a follow-up to the previous answer regarding the DNC. He says, what role did the 7 people who tested positive last week play in the DNC? Were they DNC staff members, security personnel, protesters, elected officials?
I read the email with the information that I have on that, so that's the extent of my knowledge on that. My guess is that would have been perhaps a variety of people coming through. Those were my understanding. Those are people who went through the testing procedure in order to get into the facility. And so obviously if they tested positive, they were not permitted to get into the facility because that testing had to be done the day prior to entering the facility. In other words, there were several days where I was in the facility every time I was scheduled to be there. For example, I was scheduled to be there Tuesday and Thursday. I had to go through the testing the day prior to that and get the results before I was allowed in. So I would not have been allowed in the Wisconsin Center had I tested positive. I clearly did not test positive. So my suspicion is that those would have been workers of some fashion, and just looking at the geographic distribution of where they're from, that they are workers from the metropolitan area who tested positive in the test they took, and so they were not permitted to enter the facility. But again, I give you the information that I have. You might want to contact the DNC host committee to see if they have any other information on that.
All right, our next question is from Brittany Lewis with CBS 58, and it's for either Mayor Barrett or County Executive. Can you comment on a lawsuit has been filed against the state mask mandate? What concerns do you have if the mandate is struck down?
I'll take that first, Mayor. It will cause us great concern here in Milwaukee County. We don't have a health department in order to put any type of guidelines or a mask mandate. And so we don't need the wild, wild west again when it comes down to a masking order. So we'll basically have to force many of us to work with our local municipalities to find other ways to mitigate this virus. But at the end of the day, this is something that we absolutely need, and I think it's been contributing with minimizing the spread. And I'm not sure what we will be able to do as a county, but we're going to continue to work with, again, the village boards presidents, as well as the mayors around the Milwaukee County to see what we can get done.
And I can tell you at the city level, this was something that, and Commissioner Kwolek will, I'm sure, concur with this, we had some pretty extensive conversations prior to the action we took. Initially, I think it was the commissioner's desire to have that contained in one of her orders. But as we talked through it, in particular, as we talked through it with the city attorney's office, because of the decision of the Supreme Court and because of our concern that this could get such a partisan politicization, we felt that the most prudent course for us to take, even though we felt that she had the power to do it and was we, of course, would be to have it enacted through the Common Council. That was specifically the reason that we did it through the Common Council, so that if there was a legal challenge, that it would not be a challenge to her power or my power or anyone's power, that it was duly enacted by the elected body here in the city of Milwaukee. So to the extent that there are attacks on the state action, I don't think they would have any impact whatsoever on the actions that were taken by the Common Council and that I signed into law with the guidance of Commissioner Kowalik.
Yeah, thank you, Mayor. That's absolutely right. Like, we wanted to make sure that we were supporting masks. There was a study or an article that just came out, I believe, in The Economist about the GDP associated with mask wearing. So I forget that amount, the ratio, but if someone can share that article. But there's an economic benefit to wearing masks, not just a health benefit. So I know that that's really important for messaging, depending on political affiliations or not. But nonetheless, the logic in making sure that we had an ordinance for wearing masks is to enable our community to move forward. So having it as its own ordinance and then still having orders on top of that is meant to provide that support just in case there was a legal challenge. So I'm very grateful for the strategy and the support from the mayor and the Common Council to be able to do that. Thanks.
Thank you all. And what I believe is the last question I'm seeing right now is from Anais Johnson with the Milwaukee Journal-Sentinel. And she's asking Commissioner Kowalik and Dr. Weston, can you speak more to where we are right now on other childhood immunizations? And why is this so important, especially for schools that are going back in person right now?
Yes, so we actually shared some of that data a number of briefings ago. I also had the childhood lead poisoning data. Everything is down now because of the lost time associated with the COVID response. Clinics were closed. It's hard to do vaccinations if you're not in person. You can do telehealth visits, but you still need to be in person to get vaccinated. So those numbers were down. Also, childhood lead poisoning, the finger prick or the blood tests were also down. So most providers are playing catch up right now. We wanted to make sure that the immunization element was included in the COVID safety plan for schools, really reinforcing that as a part of reopening, that you also have to follow the law that's related to immunization compliance. So if you look at that document, that there is a reference and a link to the forms that schools need to use to comply with the state law for immunization compliance.
All right. So we had a few more questions come through. The next one is from Brittany Lewis with CBS 58, and it is from Mayor Barrett and Commissioner Kowalik. She asks, we are hearing that the reason Joe Biden did not have any events here, like in Delaware, was because the DNC was following the advice of Milwaukee health officials who stated on record that they would rather not have the DNC due to COVID concerns. Is this correct?
Well, what I can tell you is that my interaction with the Biden campaign as well as the DNC was that from day one of this pandemic, they have been following the advice of national, state, and local health experts. And I think all you have to do, I always say the proof is in the pudding. And if you look at the limited travel that Vice President Biden has had since March 13th, it would have been very, very unusual for him to leave Delaware, because I think he's left Delaware maybe to go over into Pennsylvania, maybe down into Washington, over to Washington, D.C. But I don't know that he's been on an airplane since March 13th. And so I think that he was following the advice, perhaps of his own physician, of national health experts, but I certainly think that they were respectful of the concerns that we were raising here. We made it very, very clear that there were going to be local dictates, if you will. And when we said local dictates, when we were in conversations with them, there would have been up to 250 people who would have been allowed in the room with him at that time, perhaps more in other rooms of the Wisconsin Center. But in no way, I think, was this a decision that was driven by anything but health concerns that were really put forth at the national, the state, and the local level.
That's absolutely correct. I mean, our order had limited to 50 for gathering, and that's even with adequate spacing and all of that. We know that the DNC planners, DNCC, that there's been a lot of conversations that have happened to kind of forecast what would happen, different scenarios. And as the weeks were going by, we were seeing that our data was pretty stable, but not to the point of us getting to the point of not having orders and them having, a very large scale event. So that definitely was a part of the plan, monitoring, and then I guess getting to the point of, is this worth even having, bringing folks here when there's still a limit on the number of people that can be in one space. And ultimately, the biggest point of this all is safety and prevention. So like personally, I'm not getting on a plane anytime soon. And last time I flew was in January. So, I totally understand the need to protect oneself, especially if you're high risk. And it really takes some very mindful decisions about the modes of transportation that you use and opportunities for exposure to COVID-19. So definitely understand the situation.
Our final question is from Emily Files with WUWM. She asks Commissioner Kowalik, some Marquette professors and students are protesting Marquette's plans for in-person classes. Does the health department feel confident with Marquette's plan?
So we have had a number of conversations with universities such as Marquette and really walked through their plan requiring additional edits and then an opportunity to resubmit the plan with the edits. We do understand that many universities are really limiting in person. They're looking at a percentage of that, but not, of course, there's limits in rooms, the way the rooms are set up, the cleaning. There's a lot of elements here that are looking at in-person instruction, but not like you would think, not like where some like schools are like everything's open, like nothing's going on in the world. What they're doing is really employing the highest safety standards based off of the plans we reviewed and following that plan. Now, if the plan's not followed, that's a different conversation. But the plans are supposed to include a cap on in-person enrollment. So a lot of schools are looking at it like some of the classes that you need to have in person, there's no other way around them. So some of the clinical rotations, some of the labs, some of the arts, some of those things you can't do remotely, you have to do in person. So those are some of the considerations that went into these plans. And another point that I want to highlight, talking about not flying and accommodations and being high risk, is that universities and K through 12 schools are not requiring, but that they are honoring accommodations. So whether it be staff or students, but that the accommodations are being upheld. So if someone is high risk and cannot attend or is not safe to attend in person, that there's some adjustments or accommodations that are made for them to do the work virtually. So those are included in the safety plans.
Thank you, Commissioner. With that, those are the questions I'm seeing for today. So thank you all for your time, for your insight and information, and we'll see you on Thursday.
Thank you very much, Catherine.
Take care.
Thank you.
Thank you.